Turn next to Senator Ricketts.
Great. Thank you very much, Mr. Chairman. There are over 16.2 million veterans living with the U.S., including 111,000 that are calling Nebraska their home. And these brave women and men have made great sacrifices for our country when they put on the uniform. And I'm committed to making sure they've got quality benefits and care that they've earned. That's why I introduced the Tax Cuts for Veterans Act. The bill would make military retirement pay tax-free at the federal level, just like we did at Nebraska where we made it tax-free. Furthermore, across the country, there are more than 6.5 million veterans and military caregivers who provide $14 billion in unpaid labor for America's wounded warriors every year. Family and others who provide care for veterans spend on average $11,500 of their personal income in out-of-pocket expenses and related to the caregiving of their veterans every year, which is roughly about 1.5 times higher than what other family caregivers spend. The U.S. Department of Veterans Affairs offers support and resources for caregivers of veterans enrolled in VA healthcare through the VA Caregiver Support Program. This program provides caregivers with the access to VA health benefit or health care benefits, caregiver education, financial aid, mental health services, and up to 30 days of respite care. But only 34% of veterans have used their earned benefits at VA healthcare. Ms. Sawyer, over 33% of Nebraskans veterans live in rural areas that can create unique challenges for those veterans and their caregivers. Do the VA caregivers programs offer any resources that specifically help veterans and caregivers living in rural communities? And if so, how do they provide support that addresses the unique challenges that those veterans face?
Thank you for the question. So in rural areas, as with caregivers who are in urban areas and that can't get out of the home, there is there are mental health programs that are virtual programs that have been put in place by PCAFC. So if you are a member of the Program of Comprehensive Assistance for Family Caregivers, you now have access to therapy virtually through that PCAFC program. You also have options for respite care in home or in facility if they can find a home health aide caregiver, that being the concern. What I was saying earlier is in rural areas where it's difficult to find home health care workers, there are mechanisms in place where VA can raise that reimbursement rate, which would make it more attractive and possibly make health care workers more widely available in rural areas. Because as Hannah said, trying to get someone to come across the Continental Divide for $13 an hour is rather daunting. But in South Dakota, they've managed to raise the reimbursement rate to $85.05 an hour, where in Alabama it's $30.50 an hour. So if your VAs are able to raise that reimbursement rate, you would have better access to those home health care workers. Also, it's difficult sometimes for caregivers and veterans to travel to VA facilities, so certainly community care makes sense. The concern then is for the Program of Comprehensive Assistance is that those records need to be able to get into VA medical records, which is what we see is keeping people from being accepted into the program. It's not that there is a lack of need for assistance of the veteran, there is a lack of evidence of a need of assistance. And that's partly because those outside records never get into the VA, or the practitioners aren't asked about the specific needs of the veteran. What's examined in PCAFC in that evaluation process is not actually ever asked about during your yearly exam. Your PCM never evaluates you for ADL or supervision and protection needs. Those are usually done by specialists. And most of the time you see your specialist in your community rather than traveling 200 miles or 400 miles in the case of Hannah and her husband in Montana. And so you have to have that mechanism to get those records in. At Quality of Life, we actually issue a questionnaire to specialists that would actually document those needs and then have that submitted to the VA by the veteran and caregiver. So one of those things is really getting that documentation into the VA.
And so is that really relying on the veteran then for asking that, or is there another way to make sure that that kind of information can be captured when they go see those specialists?
So there is a duty to assist that exists within VBA, and we have worked with Dr. Richardson and her team to really train her team on duty to assist within VHA. It would be helpful if Congress could codify duty to assist in the Veterans Health Administration, which would mean that if a veteran and caregiver identify that there are outside medical records that need to be obtained for the evaluation process, it is VA's responsibility to get those records so that they may be considered in that process. And so while Dr. Richardson has trained her staff to do that, it is by sheer force of will and leadership power that she gets her team to do that. But that actually doesn't necessarily exist within VHA itself.
Great. Thank you very much, Mr. Chairman. Thanks, Mr. Chairman.
Thank you, Senator Ricketts.